Okay, so there are a couple of parts of the teeth or tooth that I'd like you to be aware of. There are virtually 3 layers of your teeth, and that the hardest layer, the outside layer, is your enamel. That's your protective layer. It's harder than your bones, so it really prevents you from breaking them or getting cavities easily, things like that. Underneath it is the dentin layer. It's made up of little tiny tubules that have communication directly to the nerve or the center of the tooth that we like to call the pulp, because it's not just the nerve that lives in there. It's actually made up of a bunch of tissue. It's got blood vessels and things like that within it. Surrounding the tooth, you have the bone and obviously the gum tissue. And actually connecting the tooth to your gum tissue and the bones are little tiny ligaments. So that's just kind of a general overview. So why is dental hygiene important? Well, I imagine most people like their teeth. They want to keep them for a long time, and dental hygiene can help prevent any tooth loss. Over the majority, there are 3 circumstances that can result in the loss of a tooth, and those are tooth decay, periodontal or gum disease, and trauma. So I'm going to go over those with you, and we'll start with tooth decay. Who, what, why, and how. The who is the Streptococcus mutans or the lactobacillus. I know that's a huge word. You don't even need to remember that. But what they are is the key bacteria that cause the cavities within your mouth. Why? They're bad. They're bad bacteria, but they naturally occur. And when they're made up in excess or we allow them to kind of take over, that's when the cavities happen. How do they do that? The food that we eat can assist the breakdown in our enamel. Basically, the bacteria use that food to also eat, and as a byproduct, they produce a strong acid, and it ends up dissolving our enamel, or the hard outer layer of our teeth. So prevention is really pretty simple. You just need to practice regular oral hygiene. Brush and floss and go to your regular dental visits. And fluoride is very, very important. I have a lot of questions I get asked by patients, do I really need to use fluoride? And actually, yes. It's what protects us against tooth decay. So what fluoride does for us is whenever our enamel starts to dissolve, fluoride binds to the minerals that start to break down in our tooth enamel, and actually that binding makes the enamel stronger than what it was to even begin with. So it kind of makes a super enamel. And so it's a really good protection for our teeth. And then early detection is key, and you get early detection by going to your regular dental visits. If I can catch it early enough, I can fix it with just a simple filling, and it's not a big deal. If you leave a cavity go untreated, it's going to continue to grow. And remember that dentin layer under the enamel, it's the second layer. It's a lot softer than the enamel, so once it reaches that point, it kind of explodes. It just goes really quick, and it just gets really big. And if you leave it untreated, it learns to what we call irreversible pulpitis. So that pulp, the center of the tooth, gets really inflamed, and it leads to a lot of pain. And I don't want you guys in pain, and I don't think you do either. A toothache, I hear, is worse than childbirth. I don't know for myself, but that is what I hear. Once you reach the irreversible pulpitis stage or a really large cavity, the only treatment that is left is a root canal or an extraction. So that's when you have to decide if we want to keep the tooth by removing the pulp and sealing everything up, or if you want to just take the tooth out and then you have a missing space. So that's tooth decay in a nutshell. I'm going to show you a few pictures. So early detection's on the top right there, just a simple cavity that I could fill easily. The lower right is obviously left too long, and not much of the tooth is left. So what would need to happen is either an extraction or a root canal, depending on the tooth structure that is intact still. A lot of times, irreversible pulpitis leads to a dead pulp, and you can create an abscess at the base of your tooth, and then you have a tooth infection, and those are also very painful. I'm going to hand it over to Jamie. She's going to go over the the gum part because she is my hygienist and that's what she's all about. So we're going to hand it over to her for a little bit and then I'll jump back in.
Am I turned on? Yeah. Okay, good. Alrighty, so periodontal disease is called gum disease, so I'm sure you guys have all heard of it. There are 3 stages. There's an early stage where it's just gingivitis. It's reversible, and you might notice some bleeding while you're brushing or flossing, and then it goes into a more advanced disease, and it's called periodontitis, and then this is where you're going to get to where it's no longer reversible. And then if that's left untreated, you're going to have advanced periodontitis. We're going to go into that a little bit more. Oh, wrong way. So like I said, gingivitis is the early reversible stage. It's caused just because there's plaque or biofilm bacteria left in your mouth. So typically that happens from not flossing. You can brush once or twice a day and still get gingivitis. Even if you're the best flosser in the world or best brusher in the world, you can still get gingivitis. You have to floss or use a water pick to get the bacteria out of your healthy pockets, because if you don't, it's just going to sit there and fester. It's going to start to eat away at your bone, and that's going to lead you to periodontitis, which is a lot more serious. So gingivitis is just red, inflamed gums, and they'll bleed pretty easily. And probably if you went to the dentist, that's when we're poking around in there, measuring, and hopefully we're telling you what we're finding, and that, yeah, there was some bleeding in these areas and stuff like that. That means that you can still heal it. You can make it better. If you don't, oh, there's more on that. Sorry. So proper oral hygiene at home is the best way to treat gingivitis. Brush twice a day at least. I personally recommend using a power toothbrush. A Sonicare is my favorite. It's just going to remove so much more plaque for you than you can do on your own. And it's really easy. You don't have to go over the brushing methods. You just kind of leave it on your teeth and then move it from tooth to tooth. So that's really easy. It's kind of foolproof. And then brush or floss daily to get all that bacteria or the food out that you missed with your brushing. And use a mouth rinse of some sort, whichever one you like best, at least once a day. And of course, you're going to miss stuff, and if your technique's not perfect, you're going to leave some buildup, some plaque buildup. So that's why you come see us every 6 months. Some people need to come a little bit more often than that, depending on how much they build up. So the top picture is showing you gingivitis. It's either red right around the tooth there, and the gums are puffy, and they're just inflamed. They just look kind of sore to me. And then in the picture below, they look a lot healthier. This person's obviously flossing because their gums look really great. And then if I went around and I would, use the probe to measure, I shouldn't get any bleeding with that, and they should be all healthy numbers. Periodontitis is the next step in gum disease. So this is when it's no longer reversible. You've lost bone. You've lost some attachment there. There's chronic inflammation, and it just leads to the destruction of your supportive tissues, so the gums and the bones and the ligaments around your tooth. It is an active infection, and then we start to get a lot of pocketing around the teeth. So I'm now getting 5, 6, 7 millimeters instead of our healthy 1 to 3 millimeters. So it's unfortunately, because you have lost bone, that I can get down further when I'm measuring. And so unfortunately, doing what you do at home is no longer going to clean out these pockets. You're not going to be able to reach that far. So we have to do a special cleaning, bring you in and numb you up, and then clean to the base of the pocket. And then I have to smooth out the root surface and make sure it's no longer rough so that bacteria can't really easily stick to that area anymore. And then we normally would see you every 3 months until we get you all cleared up. Okay, so that's what I just said. So this is showing a normal tooth here and then a diseased gum area on the other side. So you can see that on the normal tooth, there's nice, healthy gingiva in the bone, is that orangey, spongy looking stuff. On the other side, you can see that the bone has kind of started to go away, and even underneath the tooth between the roots, we can get through there now as well. It's a nice area for bacteria to just sit there and fester and grow. And it's hard because there's not really many ways that you can reach and get that cleaned out anymore. So we'll bring you in 3 to 4 times a year, get you all cleaned out, and then it's just really important for you to stay on top of your game at home. And then the last one is advanced periodontitis, and that's when we have periodontitis that is left untreated. So if you don't get these deeper cleanings that we recommend, then you would be in this category. Just the bone and the tissues around the tooth are destroyed even further, and the teeth will start to move, they'll be loose, they will shift. You will probably notice a really bad breath or bad taste in your mouth. And one of the scariest things with this is it's no longer just in your mouth. It's connected to your bloodstream. It's a systemic link, and it can put you at a higher risk for heart attack, diabetes, high blood pressure, stroke, any of that. So it's really, really scary, and it's something that we don't even want you to ever get to this point. That's why we try to prevent it, but then sometimes it does. So treatment, we would do advanced treatment. Usually in this stage, I would refer you out to a periodontist. They specialize in these gum issues. They have lasers and other things that they can use to clean even better than we can. And unfortunately, if it's not treated and you just leave it there, it's going to lead to tooth loss. So that's not hopefully anybody's goal is to lose any teeth. So we want to start and keep you healthy. If you have gingivitis, we want to get you back to health and not let you progress any further in your gum disease.
Okay, I'm going to jump back in here. The last way that tooth loss is common is with trauma. And trauma can be categorized as an accident or an injury to the mouth that results in the dislodging or fracturing of teeth. Now, that can be an accident playing sports, a car accident. It could just be eating one of your favorite foods and your tooth breaks, okay? So the prevention for this, typically we recommend crowning teeth that have large fillings in it. And I had some pictures for you on here, but just to kind of help you understand what I mean by large fillings. So when a tooth is restored and we take away, or we fill the tooth with 2/3 the size of the tooth with filling material, the tooth is significantly weakened. So biting down on it over and over again, eventually it's going to continue to weaken it, and it can eventually lead to a cusp fracture. And sometimes those fractures can't be repaired, and you have to extract the tooth if it's broken in a certain way. Another way is custom mouth guards if you play sports. So if you remember Stephen Curry, he's always chewing on his mouth guard. And what we do there is we take a precise mold of your teeth, and we make our mouth guards in the lab so they fit you, precisely, and it's a lot better fit and form to your teeth than it would be if you just got it from the drugstore. Another thing I'd like to add to this slide that I kind of thought of later is a night guard or a bruxing appliance. Some people tend to clench at nighttime or grind, especially if you're a high-stress person, things like that. You might not even know you do it, but in the dental office, we can notice signs such as the wearing of your cusps of your teeth are getting flat, or you're starting to cup them out. A lot of times that can lead into a fracture of a tooth, or actually grind your teeth down to the dentin layer of your tooth. And at that point, we would also need to keep the crown the tooth so that you are able to keep the tooth safe and strong and have a nice long lifetime with that tooth. Okay, so what do you need to be doing? Be diligent with your home care. Brush twice a day, preferably with an electric toothbrush. I don't care if you get it at Walmart, wherever, the ones that you can buy off over the counter, that's fine too. It's in general, it's going to be better than relying on your manual toothbrush, because for the most part, most people don't brush for a full 2 minutes. You're not getting all the areas of your mouth in the same way that you do in certain other areas. You might clean better on your right side than you do your left side, those types of things. Use fluoride whenever possible, and what I mean by that is use it in your toothpaste and use it in your mouth rinse. Listerine or Crest, they actually don't have fluoride in their mouth rinses, but you can buy at Walmart. That has fluoride rinse in it as well. And of course, floss once a day, if not more. Regular visits to your dental professionals, so cleanings every 6 months unless you're required to go a little bit more often. So we can help catch any tooth decay or gum disease that needs to be addressed. We can kind of prevent it before it progresses. So just be proactive. Like I said, early detection and intervention can prevent the irreversible damage or loss of the teeth, and tooth loss can just be detrimental to your overall oral health and just your quality of life. People don't realize how important our back teeth are for chewing, and when they're gone, that's when I get I really have to adjust how I bite. I can't eat the things I wanted to eat before. Then we got to talk about replacement options, and usually those are a little bit more financially in depth than just a typical cleaning or visit. Prevention is key, and our goal for you is to achieve and maintain good oral health, and we want you to keep all your teeth for the rest of your life. And I think that is all we have for you. Do you have any questions for me?